Hi, my name is Dr. Sharon Groh-Wargo, and I'm a registered dietitian nutritionist and professor of nutrition and pediatrics, Case Western Reserve University School of Medicine at Metro Health Medical Center in Cleveland, Ohio. Today's course is just one in a series of subjects brought to you by Channel 1, On-Demand Nutrition Education. Today, I am presenting part 1 of the importance of nutrition in the first weeks of life for extremely low birth weight infants. Here are our main objectives. I will describe the impact of nutrition provided during the first weeks of life. Strong evidence-based literature suggests a relationship between specific components of early nutrition and both short and longer-term outcomes of interest, including bronchopulmonary dysplasia, BPD, bone health, and neurodevelopmental indicators. Early nutrition mediates the influence of severity of illness in very low birth weight infants. Most neonatology providers intuitively understand that critical illness in high-risk newborns is likely to impact outcomes, but Aaron Krantz and colleagues showed over a decade ago that early nutrition practices can mediate the severity of this impact. For example, compared to more critically ill infants, less critically ill infants developed less severe BPD, and the risk was mediated by total daily energy intake during the first week of life. This paper put a spotlight on the importance of early nutrition and challenged providers to identify strategies to improve early nutrition intake. Both excess fluid and fluid restriction can be associated with adverse outcomes. One of the first nutrition decisions made when an infant is admitted to the NICU is the fluid allotment. Since infants are on an all-liquid diet, the nutrition plan is substantially driven by fluid. As the figure on the right side of the slide suggests, the decrease in weight Z-score is generally greatest during the first week of life with the contraction of the extracellular fluid compartment. A decrease of about 0.8 in the Z-score is generally considered acceptable, but that decline should level and weight gain should commence. Careful attention to maximizing the nutrition within the allowed fluid is imperative. Multiple studies have confirmed the importance of early energy intake in relationship to bronchopulmonary dysplasia, or BPD. Every 10 calories per kilogram increase in energy and energy greater than 100 calories per kilogram during the first week are both associated with reduced risk of BPD. Predictors for BPD development include a lower 4-week averaged daily caloric intake. The increased energy supports better growth, as the figure on the right shows. As nutrition, both energy and protein intake improves, moving right along the x-axis, the change in weight Z-score is reduced, moving up along the y-axis. In this study, low caloric and high fluid intake in the first week were both associated with severity of BPD in extremely low birth weight infants. As shown in the graphs on the left, infants with moderate to severe BPD, the dark circles and lines, received more fluid and less energy than age and gestational age matched control infants who had mild or no BPD, the lighter circles and lines. The table shows significant differences between the groups for carbohydrate, protein, and fat as well, but after controlling for confounders, only high fluid and low caloric intake remained associated with an increased risk of moderate to severe BPD. Bone health is affected by multiple factors, including gestational age, birth weight, length of parenteral nutrition, type of feeding, and comorbidities, as illustrated in the figure on the left. In a study by Callor and colleagues, macronutrient intake during the first 4 postnatal weeks had positive effects on both bone mineral content and bone mineral density at term and 6 months corrected age. These results may surprise us as we tend to associate minerals with bone health, but this study reminds us that macronutrient intake is also important in building bone. In the figures on the right side of the slide, you can see the mean energy intake, carbohydrate, protein, and fat intake in very preterm infants, the red circles, and in extremely preterm infants, the blue circles, over the first 6 weeks of life. Fat intake was positively associated with bone mineral content and bone mineral density at term-corrected age. At 6 months corrected age, protein and fat were both individual predictors for bone mineral density. Early nutritional intervention immediately after birth and during early infancy is important for bone health. Phosphorus is a key and sometimes underappreciated nutrient. Serum phosphorus should be tested in the first few days of life in extremely low birth weight infants, especially those with intrauterine growth restriction, as these infants are at risk for developing a refeeding type syndrome when macronutrients stimulate growth without sufficient phosphorus for mineral balance and ATP synthesis. More on this later. For early detection of metabolic bone disease, monitoring of serum phosphorus should be started no later than 2 weeks after birth. Tan and colleagues reported on groups of extremely low birth weight infants who were categorized as high risk, solid circles, or controls, open circles. The high risk group was MPO for 14 days, whereas newborns in the control group were fed earlier. As shown in the figure on the left, intakes of calcium and phosphorus were recorded during the first 2 weeks of life and were significantly different between the groups by 11 days for calcium, that's panel A, and by 5 days for phosphorus, panel B. Looking now at the figures on the right, serum calcium levels were not different between the groups during hospitalization, but in the high-risk group, hypophosphatemia started by 2 weeks, as shown in panel B, and elevated levels of alkaline phosphatase were evident by 8 weeks. That's panel C. The researchers concluded that for early detection of metabolic bone disease, monitoring of serum phosphorus should be started no later than 2 weeks after birth. As mentioned, screening for metabolic bone disease includes following alkaline phosphatase, and while this biomarker is not perfect, most practitioners agree that levels over 500 reliably predict bone mineralization. In addition, evidence suggests that both vitamin D and protein intake have a role in bone health. Incorporation of nutrition into clinical guidelines for various medical surgical complications of prematurity improves care. An example of an approach to maximizing bone health from the Children's Hospital of Philadelphia is on the right side of the slide. Their detailed algorithm is published on their website. Evidence suggests that infants who develop metabolic bone disease receive significantly lower intakes of calcium and phosphorus during early life compared to infants who do not develop metabolic bone disease. In a detailed retrospective study by Vishwanathan and colleagues, infants who developed metabolic bone disease, shown in the closed squares, had significantly lower average intakes of both calcium, that's the left figure, and phosphorus, right figure, over the first 8 weeks of life than control infants who did not develop metabolic bone disease, shown in the open circles. The combined parenteral and enteral intake of minerals matters. As we finish our discussion of metabolic bone disease, let's look at a retrospective study of extremely low birth weight infants who were evaluated for their intake of minerals in the first week of life. Infants were categorized into 2 groups. In the low phosphorus group, phosphorus of 9 milligrams per kilogram was initiated on the 2nd to the 4th day of life in the main lumen and was not administered with calcium simultaneously. See the figure on the top right. In the high phosphorus group, phosphorus of 17 milligrams per kilogram was initiated on day of life 1, simultaneously with calcium in the main lumen and phosphorus in a separate sublumen. That's the figure on the bottom right. Results revealed that intakes of both phosphorus and calcium were higher. levels of alkaline phosphatase lower, and a trend toward improved radiological evidence was present in the high phosphorus group. Parenteral calcium phosphorus in the first week of life are associated with metabolic bone disease biomarkers. Let's switch now to neurodevelopment and the impact of early nutrition. As we have discussed, optimal nutrition improves outcomes in very preterm infants. Early amino acid intake, supplementation with essential fatty acids, use of human milk, probiotics, and specific components of a complete diet are associated with lowered risk of comorbidities such as bronchopulmonary dysplasia, retinopathy of prematurity, sepsis, necrotizing enterocolitis, and improved growth, which ultimately reduce neurodevelopmental impairment. Examples of the importance of protein are illustrated on this slide. The figure on the left shows the deficit in protein that can accumulate, that's that lower line with the open squares, over the course of the first weeks following preterm birth. The figure on the right is from a paper published in 2021. Protein intake in the first week of life predicted functional connectivity and specific neurocognitive skills, such as brain processing speed, at 7 years of age. Studies suggest that early nutrition has a profound impact on specific brain development markers such as white matter microstructure and cerebellar volume. Looking at the figure on the left, cumulative lipid intake in the first 2 weeks of life was significantly associated with increased cerebellar volume on MRI at term equivalent age, after adjusting for gestational age at birth, post-menstrual age at MRI, and average daily weight gain. In a study by Sato and colleagues, data on mean macronutrient and energy intake was collected during the first month of life. You can see the nutrient values in the table on the lower right of the slide. Compared to children who did not meet enteral nutritional requirements, those who did achieve enteral protein, lipid, and energy intake recommendations during the first postnatal month showed improved white matter maturation at 5 years. The association was particularly strong for protein. In summary, this impressive group of studies that we have reviewed reinforce the urgency of maximizing nutrition in the early weeks of life. Careful attention to meeting nutritional requirements can mediate the severity of illness, including decreasing rates of bronchopulmonary dysplasia, maintaining bone health, and improving neurodevelopmental outcomes. In closing, I would encourage you to watch for upcoming Channel 1 videos on nutrition and learn more from my esteemed colleagues. Have a great day. Thank you.